Good afternoon, everyone, and welcome to today's webinar on the Electronic Clinical Quality Improvement, or eCQI, Resource Center demonstration and the eCQM annual update for 2019 reporting and performance overview. My name is Shanna Hartman from the Centers for Medicare and Medicaid Services, and I will be presenting today along with Edna Boone from Ishaq Patel. Next slide, please. Today's webinar will cover the following topics: a background on the eCQI Resource Center, the eCQM annual update for 2019 reporting and performance overview, provide you with an eCQI Resource Center demonstration, review of contact information, and we'll leave time available for questions and suggestions. Next slide, please. The eCQI Resource Center is the product of a strategic planning and collaboration across CMS and ONC with input from other federal agencies to support federal quality improvement initiatives in both hospitals and healthcare facilities across the country. We aim to provide users with the information and tools to support implementing eCQMs that will facilitate effective, safe, efficient, patient-centered, equitable, and timely care. CMS is excited to offer this resource to better meet the needs of providers, measure developers, measure stewards, and health IT developers engaged in health IT-enabled quality improvement. This website provides the most current news, events, and resources related to eCQM tools and standards. Next slide, please. Some information that is available on the eCQI Resource Center are the eCQMs, eCQI standards, such as clinical quality language, the quality data model, and the quality reporting document architecture, tools and resources, education, implementation resources, and a tools library. The eCQM specifications for the 2019 reporting period can now be found on the eCQI Resource Center. This is our one-stop shop for the most current resources to support electronic clinical quality improvement. The URL for the eCQI Resource Center is located at eCQI.healthit.gov, and you can see on the screen a screenshot of what our Resource Center looks like. This next slide here shows the eligible hospital and critical access hospital page where all eCQMs for eligible hospitals and critical access hospitals are located on the eCQI Resource Center. Next slide. The eCQMs for use in the 2019 reporting period can be found by selecting 2019 in the reporting period and hitting Apply. This page will update with all eCQMs and corresponding materials for the 2019 reporting period for eligible hospitals and critical access hospitals. Next slide, please. So our eCQM materials include an implementation checklist, eCQM specifications, eCQM measure logic and guidance document, technical release notes, and links to the QRDA implementation guide, and more. The eCQM table on this page is dynamic and can be sorted by various columns. The various columns can be sorted by selecting up and down arrows at the top of each column. Each eCQM also has an individual measure detail page. Individual specifications are available for download from these pages. The QRDA implementation guides and schematrons are also available on the QRDA page of the eCQI Resource Center and are also available within the eCQM materials list located on the eligible hospital measures page. All of this material is also available for eligible clinicians and eligible professionals on their corresponding page as well. And at this time, I'll pass the presentation to Edna, who will do a demonstration of the eCQI Resource Center.
Thank you, Shauna. Good afternoon, everyone. I'm Edna Boone and serve as the coordinator for the eCQI Resource Center. As we move through the demonstration today, there will be several polling questions. You can access the polling feature of WebEx on the right-hand sidebar panel of your screen under the chat and Q&A feature. If you are viewing the presentation in full screen mode, select the top panel drop-down located at the top of your screen and use the arrow down on the far right. The polling option will be made available to you. Our first question helps us to better understand today's audience. Please access the polling option now and select the item that best describes your eCQI Resource Center use. A, I frequently use the eCQI Resource Center. B, I use the Resource Center occasionally. C, I use the Resource Center rarely. D, I have never used the eCQI Resource Center before attending this session. We will hold for a few moments for folks to weigh in. Thank you for your participation. The results will be available for your viewing in the polling feature. Danielle, please close the poll and tally the responses. We will now begin a demonstration of the site. Okay, I see that the poll has only been open for 15 seconds, so we're going to leave that open, and I am going to continue with the presentation. This session will provide an overview of the eCQI Resource Center. As Shauna mentioned, last week, CMS published the eCQM annual update for 2019 reporting and performance period on the eCQI Resource Center. Recently, the site was updated to a tab format to improve usability. Today, we'll review key sections and features of the site, including the home page, advanced search, the eCQM page, the eligible professional and clinician page, the eligible hospital and critical access hospital page, tools and key resources, eCQI standards, education and implementer resources, clinical decision support information, requesting a user account, and receiving updates on topic areas of interest. Lastly, we will provide opportunities to engage in the eCQI community. The site serves as a one-stop shop for the most current resources to support electronic clinical quality improvement. We are always seeking ways to improve the site and expand content pertinent to clinicians and quality improvement specialists. We encourage your feedback. In some cases, the site points to external sources of information. Our goal is to not duplicate existing resources, but rather to give users a one-stop shop to find information. The eCQI Resource Center is a source of truth for the eCQM specifications and the CMS Quality Reporting Document Architecture, QRDA, implementation guides, schematrons, and sample files used in CMS quality reporting programs. The home page includes both news and events. Each news item can be opened and expanded to see the full story. Users are encouraged to submit news and events via the email found in the Contact Us section. News and events submitted will be reviewed by appropriate federal staff and approved before posting. The site has an easy access blue topic bar across the top of the website. This feature allows for easy navigation to the major topics across the site. The home page also provides 4 large blocks, each with a link to more information highlighting key resources of interest to end users. They are eCQMs, education, eligible hospital and critical access hospital eCQMs, eligible professional and clinician eCQMs. Additionally, there are 3 sets of links at the bottom of each page: helpful links, related information, and external links. The helpful links section includes links to FAQs, a fact sheet regarding the eCQI Resource Center, and a glossary of eCQI terms, which provides simple definitions for terms used in conjunction with eCQI. The related information section provides links to key CMS resources, such as meaningful measures, the CMS measures inventory, and the CMS measures management blueprint. External links section helps users navigate to external resources such as the ONC JIRA issue tracker, USHC, and the Value Set Authority Center. The search feature on the site allows for advanced filtering and searching by category. For simple search, type the term you are interested in the box to the left of the search button, located on the top right-hand side of the web page, and select search. For example, typing eCQM and selecting search, the end user is presented with a list of all items on the site for eCQM. You can narrow the search by content type, date created, date updated, measure year, etc. By selecting event under content type, the search narrows to a listing of past, present, and future events that feature eCQM. A user can also search the site by browsing available categories. Begin by keeping the search fields blank when you select search. Narrow your search. Narrow your search by selecting a hyperlink of interest in the filtered category, such as beginner user level. Selecting beginner user level provides a list of all content on the website suitable for those with limited eCQI experience or knowledge. This list can be further narrowed by selecting a hyperlink of interest such as eCQM certification. The list further narrows to eCQM certification topics for beginners. Next, we will review the eCQM page, which includes an introduction to eCQM. You can open the eCQM page using the link in the box on the home page or using the link on the toolbar. The page is now organized in a tab format. The About tab provides a brief overview of eCQM. The Development tab provides information regarding the process for creating and updating eCQMs. The Tool and Resources tab provides links to tools used for eCQI improvement. We will go further into the detail of how the tools library functions later in the presentation. The Education tab takes you to the educational resources for eCQM, and the Connect tab shows you how to get involved, provide feedback, and ask questions regarding eCQM. There are links to the eligible professional and eligible clinician eCQM page and the eligible hospital and critical access page on the quick toolbar at the top of the screen, and also, again, on the 4 boxes below. We will review the eligible professional and clinician eCQM page, looking at the list of eCQMs, supporting materials, viewing measure details, and show how the links to the United States Health Information Knowledge Base, or USHC, work. The page has a feature which allows you to select measures and filter by reporting a performance year. When you select a performance year period and hit apply, the eCQMs and supporting materials for that year will be presented on the page. For example, when I select 2019 and hit apply, the required eCQMs and supporting materials to be used for 2019 reporting performance appear on the page. As Shauna mentioned earlier, the 2019 measures on this page are not for use in CMS quality reporting programs until the final program rules are published. A list of key materials presents on the page. A link to the eCQM implementation checklist, a guide to reading eCQMs, a PDF table of all updated eCQMs available for use by eligible professionals and eligible clinicians in 2019, a zip file containing all of the eCQM specifications, a link to the value sets, a link to the binding parameter specification, a measure logic document to assist in technical implementation of eCQM, and PDF and zip files containing individual technical release notes highlighting what has changed in the individual measures since their last release, and a link to the pre-publication document which provides versions of standards and code sets used in a specific reporting and performance year. Links to measure, logic flows, QRDA, implementation guides, and benchmarks for the 2019 reporting year for eligible clinicians and professionals will be available as soon as they are published. By filtering on 2018, the measure logic flows, quality benchmarks, and QRDA implementation and files are available. When you move your cursor over the measure logic flow files, you are presented with a list of each measure included in the zip file. Below the supporting materials is a table which is dynamic and allows for sorting column by header. When selecting the CMS eCQM ID, the table automatically sorts in ascending order by ID. Selecting this header again will sort it descending order. The other columns work in a similar fashion. We will pause for a moment for our next poll. Please access the polling feature and respond. This question is in response to the key feature regarding the sortable table on the site. Danielle, if you could load that polling question. A, this is an important feature I use frequently. B, this is an important feature I use occasionally. C, this is not an important feature to me, I do not use. D, I was not aware this feature existed, it would be useful to me. And E, I was not aware this feature existed and it will not be useful to me. We'll pause for a moment, allowing you to weigh in. So thank you for your participation. Danielle, you can keep the poll open for a few more moments and then close. And again, the results will be available in the polling feature. You can see the detail page on any given measure by selecting the measure name in the table. The detailed measure page contains the information that is included in the measure specification XML and HTML files. This view does not include all the fields in these files, but is a user-friendly and readable summary of the measure. From this page, you can also download the individual zip or specific files for a given measure. Included in the detail page are the measure release notes. The release notes are broken into the header, logic, and value set sections. This is the same information that is included in the Excel file found within the technical release note zip file for the eligible professional and eligible clinician measures. Note that new measures will not have a detailed technical release note. So when scrolling to the bottom of the 2018 table, I would like to highlight that CMS 347 and CMS 645 are not available for the Medicaid EHR incentive program for eligible professionals in 2018. Likewise, the imaging study measure is only available for Medicaid EHR incentive program in 2018 and not for QPP. We will now pause for our third polling question. Please access the polling feature and respond. When accessing eCQMs online, I, A, download the files I need containing multiple measure details, B, download the files I need containing individual measure details, C, view individual measure details available on the site, or D, don't use the eCQMs and their associated data. Again, we will pause for a moment. Danielle, if you will leave this open for a while, and folks, again, can look at the polling for the results. So the measure table can also be used to navigate to the USIC site and pull up measure detail or compare measure information from one year to the next. From a specific measure on the table, you can select version detail under the USIC version link column. If you'd like to select and see measures side by side, use the version compare. If you have a UMLS login and password, you can use it to access the measure compare feature, which will include all code set details. If not, you can select bypass authentication on the USIC page to arrive at a page that opens the selected measure. The default is to compare the current measure version and the version for the previous year. I'm going to select another measure. I'm not sure why we have issues there. I do want to note that the USIC has not been updated with the 2019 measures, and it is expected to be updated in late June. I'm going to skip this compare for now, and Danielle, we will also skip the corresponding polling question and come back to that functionality, and here we go. Oh. All right, let me stick with this. So we have, what we're seeing on the screen here is a comparison between 2016 and 2017 cervical cancer screening. Those items that have had a change have a red exclamation point in this first column. And again, if you are signed in with UMLS, you will also see code changes. So with that, Danielle, if you could load our fourth polling question, please access the polling feature and respond. Use of the key feature, version compare, such as USIC. This is an important feature, and I use it frequently. This is an important feature. I use it occasionally. This is an important feature to me. I do not use. I was not aware this feature existed. It will be useful to me. I was not aware this feature existed. It will not be useful to me. Okay, and we're going to navigate back to the top of the eligible professional and clinician page, and we see that there is a View Archive link above the materials table. Selecting View Archive opens up a page showing the table of archived eCQM materials. These files were previously published by CMS and have been updated by addendum. The content of these files is not current and should not be used for reporting. We'll now take a look at the eligible hospital and critical access hospital eCQM page on the Resource Center. This page is set up exactly like the eligible professional and clinician page. The main difference is content. The hospital page has a QRDA-1 implementation guide and files versus QRDA-3. There are no measure flows for hospital measures, and the table also includes a short name, which can be sorted. Lastly, there are hybrid measures beginning in 2018. There is a separate table with a link to a voluntary measure, the hybrid hospital-wide readmission measure. This is not a typical eCQM, as it also uses CMS claims data. Here you will find the measure specification as well as a link to the value set in VSAC. We'll now provide an overview of the CMS Tools and Resources page on the Resource Center. The 3 tabs, About, eCQM Standard Tools and Versions, and the eCQM Tools Library. Under About, you will find an interactive eCQM graphic. This provides an overview of the tools, standards, and resources used in various stages of the eCQM lifecycle. By using your cursor to hover over a component on the graphic, you will see a pop-up which invites you to visit its location. The address for the link is provided on the lower left corner of the screen. If you click a component, it will take you to that tool, standard, or resource location. The eCQM Standards and Tool Version tab provides a chart with the tool and standard versions used in the development and use of eCQM for each reporting and performance year. The chart provides direct links to the tools and standards when available. A PDF of this chart is also available for download here. A listing of tools and resources available in the eCQM tools is available in the eCQM Tools Library. Each tool has a brief description of the tool or resource, a category for which it is used, and a link to the tool or resource. The Tools tab is organized in alphabetical order and can be searched by certification, communication, continuous evaluation and feedback, development, implementation, publication, reporting, and testing. An example of a key resource is the CMS Measures Inventory tool. This tool allows users to sort, filter, and search measures. Sorting by category of tools and selecting reporting provides a list of tools and resources used for eCQM reporting. Next is an overview of the eCQI standards. The standards are located via a link across the Quick Access menu. There are 4 standards in this dropdown: CQL, HQMF, QDM, QRDA, and a page which covers CDF and eCQM harmonization efforts. Let's begin with the quality data model. The quality data model provides the language that defines the criteria for clinical quality measurement. There are 4 tabs: About, Previous Versions, Education, and Connect. The About page has links to the most current version of QDM, and while the Previous Versions tab provides links to earlier versions. There are links to QDM educational resources on the Education page, including QDM questions and answers. The Contact tab provides information on ways to connect on this specific topic. Next, we will look at CQL, Clinical Quality Language Standard. The CQL standard is part of an effort to harmonize efforts between eCQM and clinical decision support. CQL provides the ability to express logic that is human readable, yet structured enough for processing a query electronically. The eCQMs for 2019 reporting and performance use CQL. On the About tab, you can find details on the standard as well as a link to the current CQL specification. Under the Tools and Resources tab, there are links to tools such as the CQL Formatting and Usage Wiki, and the CQL Online tool. There are links to CQL Education resources on the Education tab, and the Connect tab provides ways to connect on this topic. Another standard is the Health Quality Measure Format, or HQMF. The HQMF standard is used for representing the quality measures as electronic documents. Key information is available in a similar format along the tabs here. The Quality Reporting Document Architecture, or QRDA, is a standard document format for the exchange of eCQM data used when reporting eCQMs. The About page has links to download current files for QRDA 1, QRDA 3, including implementation guides, schematrons, sample files, and links to QRDA-based standards on the HL7 site. By selecting the tabs on this page, you can learn more about QRDA, related tools, resources, education, and how to connect on this topic. Lastly, in the standards section, the CMS eCQM harmonization page highlights quality improvement standard evolution. As standards and tools mature, we expect to see more information about clinical decision support and its relevance to quality improvement. Adoption of CQL and eCQMs is the first step. Next, we'll provide an overview of the pages providing additional information found under Learn More About. Here we have links to About eCQI, Clinical Decision Support, Education, Ways to Engage, Frequently Asked Questions, the Glossary, an Implementer's Corner, and information on Kaizens. The Education link provides access to the Education page where resources on a variety of topics are located. As we showed earlier, the Education page is also available via the box on the home page. This page is organized in 6 subcategories of educational topics. There are 3 subcategories of general, educational resources, eCQM, eCQM tools, and the Resource Center. There are 3 subcategories for standards education, CQL, QDM, and QRDA. Each of these boxes provides a hyperlink which opens to another page with educational resources on that topic. New resources are continually being added as they become available. Each education topic page is organized with the most recent resources at the top. The date and file type of each resource is also provided. The CDS page provides information on CDS efforts and resources. By selecting the tabs on this page, you can learn more about CDS, related tools and resources, links to CDS standards, and how to connect on this topic. From the Learn More About, we have a page for eCQM implementers. This section provides resources available for those implementing eCQM. By selecting the tabs on this page, you can learn more about the technical and process workflow implementation resources. A link to the Engage page is also found under the Learn More About. Users are taken to a page with a table that provides information on ways to engage with the eCQI community. Along the top of the dynamic table are column headers for the various stakeholder roles with arrows that allow a user to sort. Each row of the table displays a different opportunity along with a description. The X's denote a match for suggested stakeholder roles for each opportunity. By selecting the provider column, the table sorts with opportunities for providers to engage. We will now pause for our final poll. We will ask for this question to please access the polling as well as the chat feature and respond. Danielle, if you can bring up our last polling question, select the item that would be most helpful to you for the eCQI Resource Center to provide. Direct links to the CMS Measures Inventory tool to highlight in which programs eCQMs are used, improved use on a mobile device, additional education on implementing eCQMs and emerging standards such as FHIR, or use the chat feature for other if you have more than one selection or other suggestions. We will pause to allow folks to respond. So lastly, we will review how to receive updates on topics of interest on the eCQI Resource Center. The site allows for users to follow specific pages on the eCQI Resource Center and receive automatic email updates when content is added or changed. To create a user account, you need to select the login link on the upper right-hand corner of the home page. On the login page, select the Create an Account if you do not have an account. An email will be provided to you. You will automatically be accepted for an account, and you will need to set up a sign-on and password. I'm going to go ahead and log in. Once you've created an account and are logged into the Resource Center, you can navigate to any part of the Resource Center that you want to receive updates on. There we go. So again, once you're logged in, you can navigate to a part of the Resource Center that you want to receive updates on. For instance, if you want to receive updates on all new content added to the Education page, select the Education page, and at the bottom left-hand corner of that page, you will see a Receive Updates on this topic. Click that link. Select Join, and you'll be subscribed to receive email updates anytime new content is added to that page. You can unsubscribe from a page at any time via the same method. Select Stop Receiving Updates on this topic link from any page you have previously subscribed to, and confirm with Remove. Once logged in, you can also see your username on the upper right-hand corner of the site. You can adjust email settings in your profile under Settings. Here you can specify your preference to receive plain text or HTML emails, individual emails, or a daily or weekly digest. Users can also check what content they are following by looking at the activity page and choose to unfollow. To log out of the Resource Center, select Log Out from the drop-down. Users will automatically be logged out of the Resource Center after 30 minutes of inactivity. So this concludes the demonstration portion of the presentation. We encourage you to provide feedback and suggestions on the site and to submit eCQI news and events to the eCQI Resource Center at hhs.gov. Additionally, we encourage you to share the site with your peers and to add a link to the eCQI Resource Center from your website and/or include in your newsletters.